whenever patients are signing up for health insurance, one of the first questions we ask is, do you have an HMO or PPO?
Or PPO.
We just got in that discussion a few moments ago.
Yeah, we did.
Right? Because, again, my co-host here, you don't care if I tell him that you have asthma? Do you care?
No, go ahead, please.
So co-host here has asthma and is not treated very well.
It's not.
And so I said, hey, I'm just going to call in a prescription right now. I'll call it in. I'll have the pharmacy just deliver it here so you can have your inhaler because you've been coughing all morning. Right?
Yes.
But turns out she has an HMO. So I can't just call any random place for her to get her prescription.
Yeah.
I have to get it from her particular place that's an HMO. So that's what an HMO is, right? So an HMO is an organization that provides care. You're prepaying care, but there's a certain network of physicians that can see you.
I was going to say provides care, even though we're running into
Right, exactly, right. And then there's also a certain pharmacy that can give you drugs, right, as well, drugs that are needed.
Yeah, specific pharmacy.
Right, and so if you want to go outside of that, you just have to pay cash. Like they don't pay for anything outside of their own thing.
Exactly.
And there's a certain formulary they have, and there's certain rules and regulations. HMOs are typically speaking a little bit cheaper when compared to PPOs, which are more kind of patient-centered, so patients can kind of go anywhere that they want to go. The PPO will pay for some of it.
Yeah.
Those premiums, and by premiums, I mean the amount of money that you're paying every month are a little bit higher, right? So those premiums, and I think I wrote it down, the average annual premium for a PPO is $8,900. The average annual premium for an HMO is like $8,200. So you just divide that by 12 to get the monthly fee, which is kind of expensive. I mean, it is expensive.
Yeah.
But with a PPO, which stands for a patient provider organization, a PPO, they have networks of physicians as well. You can go to those networks of physicians, but there's also some out-of-network funding that you can get if you want to go see a different kind of physician.
And even you just explaining this, it gets so messy.
Yeah.
Right?
It can.
It's not straightforward, in my opinion. I mean, I have this discussion with my patients all the time.
Yeah.
And they're like, what avenue do I even go down? How do I know which avenue to go down?
Yeah, and it's such an interesting question because for me, and again, we're talking about individuals that have health insurance. The way that I answer that question for my patients is I will say, all right, well, let's look at your specific plan and see what your plan actually covers. And I think understanding what your plan covers comes with understanding what medical history you have.
Yes.
Right? So what medical history do you have and what medications do you need? Because whatever plan that you have or that you select, you want to make sure that it covers what it is that you have. And then even your family, right? What does your family have? Now, the numbers I just quoted about HMO and PPO price, that's for like one person.
Right.
If you're including like family,
which most people are,
it goes up significantly. It's like $24,000.
Yeah.
Right. So like for an HMO, it's $24,000 for a family. For a PPO, it's like $25,300.
I don't think there's a lot of physicians out there, providers out there that are doing what you're doing, though. You know, I think a lot of patients do come to their provider hoping to get some sort of guidance.
Yeah.
Right. And you have your patient come in and you're like, we're talking about your heart or your lungs today. We're not talking about what insurance you should pick.
Right. And again,
so then they're kind of like lost again. Right.
And again, this goes along with your staff. So it takes time, right? So I have the office manager in my practice. And my practice is I share an office with 3 primary care providers, a father and 2 sons. The father's been practicing medicine for like 65 years, and he's had the same office manager for probably 40 years. So this person is the most valuable person in our practice because she knows all the insurance plans, backwards, forwards, what they cover. She is like the god of health insurance and like understands.
Well, you're blessed.
I'm completely blessed.
Every office needs that, but I wouldn't say every office has that person, unfortunately.
No, because this isn't something that we're exactly taught.
And we're not.
Yeah, as we go through healthcare, as we go through all of our training.
I think that's a really good point to the public as well, is that even as providers, there's a lot that we don't know about the healthcare system, how things are paid, where the money's coming from, so on and so forth. We do our best to educate ourselves.
Right.
But there's an opaqueness to it all that makes it a bit challenging.
Yeah, and I think most people have to understand that having a job, right, and having an employer That's generally speaking how like 65% of people in this country get their health insurance.
Right.
Right. They have an employer and the cost is split between patient, employer, right? Period. End of story. That's how it goes. Right.